Before beginning, make sure that the patient has a gait belt. The gait belt should be fit snugly around the patient's waist, and also note that you should never grab the patient's clothing. Clothing can be torn, or even grabbing the belt could pinch the patient. Please use proper guarding techniques as well. To begin, the patient should be standing with a gait belt on, and their feet should be side by side with a cane beside their fifth digit. The therapist will be behind and towards the side of the patient. The therapist grabs the gait belt and shoulder. The patient will advance the cane forward approximately 1 stride length. The therapist will step forward with their left outside foot. The patient then moves her lower extremity, opposite of the cane, up to the cane position. The patient advances the lower extremity, same side of the cane, past the level of the cane, opposite of the extremity. This should be encouraged by the therapist because it promotes a normal rhythmic pattern of gait. Initially, the patient may bring their lower extremity up to the position of the cane. The therapist will move their right inside foot as the patient is moving her lower extremity. The sequence is repeated. As the patient improves, the patient may move the cane and lower extremity opposite the cane at the same time to permit a faster gait pattern. Here is an example of how bringing the cane and the affected limb together can create a faster rhythmic gait pattern. It is recommended to use the stronger limb when pivoting. For this example, the cane is on the right hand side of the patient. His affected limb is the left lower extremity. To begin, the patient shifts all of his weight onto the right lower extremity, and he will move the cane forward into the right, as well as moving his affected limb forward into the right as well. The patient will be pivoting the entire time on the right lower extremity. The therapist will have his hand on the shoulder of the patient as well as his hand on the gait belt. Here is an alternative to the method I just previously showed you. Instead of pivoting on the right lower extremity, the patient can simply lift his right foot off the ground. This is a useful strategy, especially when maneuvering over a carpeted area. When encountering stairs, the patient has an option to use or not use the handrail when available. For this particular example, we will not be utilizing the handrails. The patient places the uninvolved or least affected lower limb on the stairs. Then, the patient extends their body upwards while simultaneously bringing the involved limb with them. After the patient is stable on that step, the cane is brought up to them. An alternative method is placing the cane and uninvolved limb both on the step and extend upward to bring the involved limb to the step. If the patient wants to use the handrails, they have several options. If the cane is on the side of the handrail, 1, they can place the cane on top of the handrail, parallel with the handrail, and then slide it up as they ascend. 2, they can just simply grasp the handrail and the handle of the cane from one hand, or the third option is they can grasp the shaft of the cane and the handrail. Please note when using a quad cane, the entire cane has to be on the surface of the stairs. To do this, just simply turn the quad cane to the side, and then everything should be the same. When descending stairs, the patient should be facing forward with their feet side by side. The patient places the cane on the lower step. Next, the patient lowers their involved limb to the step. At the same time, the patient will be flexing their uninvolved lower extremity. The cane can be used to support some of the weight as the patient moves their uninvolved limb to the step. This is also a good time to talk about curbs as well. In this video, I will not be showing or demonstrating how to properly maneuver over curbs. However, the same concepts of ascending and descending stairs applies, except the patient will not be utilizing handrails. When moving from a standing to sitting position, instruct the patient to feel for the chair behind the back of their lower extremity. The patient's feet should be side by side, and the therapist should be positioned in stride into the side and behind the patient, grasping the gait belt and shoulder. The patient grasps the armrest behind him and the patient can do this either one at a time or simultaneously grabbing both armrests. The cane is grasped with the same hand that was used for ambulation. The patient should grasp both armrest and cane at the same time. As the patient descends into the chair in a controlled manner, the cane is moved towards the side, and the patient moves all the way back into the seat and positions himself appropriately.